Hello and welcome everyone to this session on Unacademy. My name is Dr. Jhanvii. I am the anesthesia educator on Unacademy and I hope you guys are able to see me and hear me well. Now a lot of you have given the NEET PG exam and don't know what to do. Many of you all are calculating your scores. Many of you all are going all nervous and messaging me, ma'am, should I consider anesthesia? How is it as a branch? Should I take a clinical or non-clinical branch? What will my future options be? So that's why I'm taking this session for you guys. I thought it's a good time to invest in knowing the branches that are there, because it's not necessary that during your MBBS days you will be rotating in each and every subject and knowing completely about it कि आगे जाके उसमें होता क्या है, how is your life going to be, what kind of package will you earn, what kind of hours will you work. So all of those questions about anesthesia I will be answering today. So welcome to this session. First of all, I hope you guys are able to see me and hear me well, and then we can begin. Yeah, I can see that the streaming is absolutely okay. Now you guys can answer you guys can ask me any queries that you have about the same, and I would be happy to answer your queries about taking anesthesia as a career option. So first of all, welcome to Unacademy. The Plus subscription on Unacademy will help you get access to both live and recorded classes. You will learn from India's top educators. You can compete in live tests and quizzes. You can study on the device of your choice. You can access our question bank with 25,000 plus questions. And we now have printed notes for those with 12-month and above subscription. The iconic subscription on Unacademy will help you get the live lectures of Unacademy along with the video lectures and question bank of Prep Ladder. And in our special classes, which are absolutely free for all of you all to attend, we have interactive sessions, we have polls for the learners, raise a hand option in which you can ask us live whatever doubts you have. And we also give you printed notes of the session at the end of it. This is our question bank with 25,000 plus questions, and these are a few of our batches which are on right now. So we have the Focus FMG batch for FMG 2021, and we have the Target Next 2022 batch for those giving next year's NEET PG exam. These are a few offers that are going on about the Unacademy subscription. So you can buy 24-month, that is 2-year subscription, and get 4 months free. You can also buy the 12-month subscription and get 2 months free. And my referral code is Dr. Jhanvii Live. If you would like to buy the Unacademy subscription, don't forget to use this referral code and you will be able to get 10% extra discount on your Unacademy subscription. So let's begin with the first question that most of you have. For anesthesia, what would be the cutoff rank? Okay, so usually if you go to see, anesthesia is not something which goes at a very high rank. So even if you are calculating your marks right now, many of you all are messaging, ma'am, out of 200 I'm getting 140 questions correct, I'm getting 150 questions correct, I'm getting 160 questions correct. So depending on, now this year's paper was quite easy, so I'm expecting that the cutoff would be a little high. But for those of you who are in that mid zone, don't know whether I will get a good rank to get a residency, or I feel that I might have to repeat the exam. If you are in that transition zone, then definitely this class is for you. You can consider anesthesia as an option. There are some of you who are like, nahi, bas ho gaya abhi padh ke, whatever branch I get, I will take it up. So for them specifically, super branch to take up. Many of you all feel कि नहीं, anesthetist को doctor नहीं consider करते इंडिया में, anesthetist को भाव नहीं देते इंडिया में. So let me tell you, as we proceed through this class, I will give you at least 10 reasons to fall in love with this branch. So the expected cutoff rank for anesthesia, if we are talking about a seat in a government medical college, then if you get anything between rank 1 to 15,000, you should easily be getting a seat in MD anesthesia. If we are talking about private medical colleges, so those that have DNB teaching in them, So in private medical colleges, between rank 15,000 to 30,000, you should be getting anesthesia easily. So if you are coming within the first 30,000 all India ranks, you should be getting anesthesia in one of the good institutes. Okay. Now if you ask me to get anesthesia in the top institutes, so top institutes will basically be in Mumbai. You have KEM Hospital, Nair Hospital, Sion Hospital, Tata Memorial Hospital. Then in Delhi, you have, of course, you have Gangaram Hospital, and you have many of the super specialty, Max and everything has good DNB anesthesia. Then and LHMC, AIMS and PGI is out of question because that was a part of your INI-CET, AIMS, PGI and JIPMER. Okay, so these are some of the top hospitals for anesthesia in India, and to get into these top hospitals, your rank in NEET PG should be less than 5,000. So you will easily get one of the seats over here. Alright, so this is our expected cutoff rank for anesthesia. If you go to see, it's not a very high rank that is required for the exam, and it is not a very low rank also. ऐसे नहीं कि someone is just leaving the seat and you're picking it up. Okay, so this is a decent rank for those who have felt that your performance in the exam was average. This is a very good option for you. Second, for those who don't want to repeat again, not interested in repeating again, you can take up anesthesia as your option. Alright, so everyone, your questions are welcome in the chat box. If you have any questions specifically, you guys can ask me. Alright, so the next thing I want to discuss with you is government versus private medical colleges. Now, first of all, it is the degree. So in government medical colleges, the degree that you will get is MD. In private medical colleges, the degree that you will get is called as DNB. Okay, so what is the main difference between MD and DNB as you do it? Okay, so while you are doing it, as in when you're doing your residency, obviously the workload, so let's write over here MD and DNB. The first thing you need to talk about is the workload. Okay, now remember, anesthesia is a skill. The more you practice your spinal, epidural, GA, intubation, emergency cases, more of the super specialty cases, the better anesthetist you will become. So definitely the workload in any government medical college will be very high. So your MD will be preferable than DNB. But don't think that DNB anesthesia is bad. There are some hospitals, some private medical colleges which are so hectic, they are actually more hectic than even your government hospitals. So they have long duties, long working hours, and plus they have adequate exposure. So there are also DNB hospitals which are having a lot of work in anesthesia. So don't exclude that option completely. The second thing is the payment. Okay, so this makes a lot of difference during residency also, because many of you all start not depending on your parents. You want to make money on your own and start surviving on your own money. So for them in the government medical colleges, you get a slightly higher salary as compared to in DNB. So now you all may ask, ma'am, how much is the salary exactly? So if we are talking about Mumbai, because I have trained in Mumbai, so in Mumbai, your typical residency salary will be anywhere between 60 to 70,000 rupees per month. Okay, whereas in DNB you could be expecting a salary between 40 to 50,000 rupees. So it's not much of a difference, but yeah, if every 10,000 I feel does make a difference. So if you have a family to support and you want to make sure that you're earning well enough for the family as well as to save, then MD is a better option as compared to DNB. Okay, now next thing, what about exposure? What do you mean by exposure? So exposure means how many super specialty areas are you going to train in. So for example, there are government medical colleges where you will be having training in neuro anesthesia, cardiac anesthesia, pediatric anesthesia. So most of those tertiary care centers, like the main government hospital in your city, will have a very good exposure to all these super specialties. Now, why is this exposure important? First of all, to develop as an anesthetist, to learn different kinds of skills and to learn anesthesia for different kind of patients. This is very important. Second of all, it gives you an idea ki should you be doing neuroanesthesia as super specialty, should you be doing pediatric anesthesia as super specialty. So it sort of gives you an idea, are you developing an interest in the branch and do you want to do a super specialty in that or no. Okay. Now, exposure in Dnb hospitals is also very good. So unless you are joining a hospital which is in a very remote place where there aren't too many patients, or if you're joining a private hospital which is like having DNB seats but is very specific, like for example, if you're joining a private hospital which has just orthopedics, then in that case you will not be rotated in cardiac, obstetric, pediatric, anesthesia and everything. So this is one of the major points that you guys should consider whenever you are thinking of picking up your seat for anesthesia. Your hospital that you choose should have the maximum amount of exposure. Okay, so see that they have all the super specialties available so that it gives you a good idea about anesthesia for all different branches. Okay, now the last and the most important thing is about your job opportunities. So many people say that if you are MD, you get better job opportunities as compared to if you are DNB anesthesia. Now that is an absolutely false statement. Okay, your job opportunities as MD or DNB anesthesia is absolutely equal. In MD anesthesia, if you are going out and you're telling people that I have done anesthesia, they are not going to ask you whether you have done MD or whether you have done DNB. This is when we are talking about freelancing. Freelancing means you will be called by say 4-5 surgeons to do their private cases. So in that case, they will not care whether you are MD or DNB. The only thing that they will bother about is whether you are giving safe and effective anesthesia to your patients or not. Okay. Whereas if you talk about joining a corporate hospital, in a corporate hospital, again, they will not ask you whether you're MD or DNB anesthesia. What they will ask you over there is what is your years of experience of managing patients alone. Okay, so they want to see how skilled you are and how many years of experience, and they actually look at the soft skills more. So soft skills means they will see how you talk to the patients, are you courteous to the patients, do you ask for too many unnecessary investigations or no. So they will try to get someone who's cost effective, well experienced and talking well to the patients, because at the end of the day it's a private corporate hospital. Okay, now if we are talking about medical colleges, if you want to join a government medical college for a job, or if you want to join a teaching institute for a job, there you may have a slight difference and preference for MD anesthesia as compared to DNB anesthesia. So when they see your list of degrees, they will see whether you've done MD or DNB. But there is one way to overcome even that slight difference, and that way is very simple. You make sure that after doing your DNB, if you're planning on joining a government institute, make sure that you do some good fellowship or some good super specialty, so that on your CV it looks like you have done more than someone who has just done 3 years of MD. Okay, so again, eventually if you're talking about MD versus DNB, if I had to take up a seat in this NEET PG exam and I have decided that I'm going to take up anesthesia, I would not think twice. I would rather focus on the hospital which has good exposure. There may be a government hospital which has very less exposure as compared to a DNB hospital which has many super specialties. So in that case, I would rather go for a DNB anesthesia degree at some place which is giving me more exposure to all different super specialties of anesthesia. So For those of you who are confused between whether to take government or private college, I hope that answers your question. So till now we have answered what is the expected cutoff rank for anesthesia, what are the top institutes for anesthesia, what is the government versus private college boons and banes, and now we will discuss how is your residency in anesthesia. So whether you are doing MD anesthesia or you guys are doing DNB anesthesia, it is a 3-year course. Okay, now remember, in MD after 3 years you will have a bond. Many states have a bond over here, so this bond can range anywhere between 1 to 3 years. So when you are filling your preference forms, make sure to see that bond in that state is for how many years. Okay, because then you have to complete the bond. It's not like you can leave immediately after your MD and come at any time and do the bond. No, these bonds basically amount to a lot of money. Like for example, in Maharashtra the bond is almost 50 lakh rupees if you don't do it. So you have to immediately complete the bond and then go ahead with your super specialty studies. For DNB, you don't have a bond anywhere, so that way you save your 1 to 2 years post DNB. Alright, so that is about your MD and DNB 3-year course. Now let's discuss what would you do, how would your life be as a first year resident in anesthesia. Now this is very interesting because क्या होता है ना, if you speak to a first year resident in orthopedics or a first year resident in surgery, medicine, pediatrics, they will not even get time to eat, they will not get time to bathe, they will not get time to go back to their room. Enjoyment, holiday तो भूल ही जाओ. Okay, all these branches are super duper hectic and there is no work life balance. But in anesthesia you definitely have a work life balance even as a first year. Okay, so in anesthesia, how is your typical day like? So generally elective OTs will start everywhere at 8 AM and they will finish by say 5 PM maximum. So this whole day you will be working in the operation theatre. Now it depending on what kind of operation theatre you are posted in, whether it's neuro, pediatric or ortho, the number of cases will be according to that and also according to the hospital that you're in. So sometimes it may be very busy and you'll be running around. Sometimes there will only be one case going on from 8 AM to 5 PM. So the minute you induce it, you can aram se chill and just monitor the patient till 5 o'clock and then you can extubate and go home. Okay, now this is how your typical OT will every day of your life will be as an anesthetist. Now along with this, this is your routine or your elective OT. अभी ये routine और elective OT में if you were doing medicine, pediatric, surgery, ortho, you ask them when do you eat between 8 AM to 5 PM. They will say we eat before 8 AM and after 5 PM. But as an anesthetist, you will get a chai break. 100% there will be one chai break. So the minute all the patients are induced, your senior anesthetist will ask you, have you done your breakfast? Chai pee ke aayo kya? And they will send you for your chai break. Okay. After the chai break, at a decent time, 1 o'clock, 1:30, depending on how busy the OT is, you will be having a lunch break. And before 5 o'clock, that is before you go home, there will also be another chai break. Sham ka chai break. Okay. So there will be a morning chai break, there will be a lunch break, and there will be an evening chai break. Now of course this changes from institute to institute and senior to senior, but this is like an unsaid code of conduct between anesthetists कि no one should stay hungry. ठीक है, stay hungry means it is stay foolish only. So anesthetists are the ones who always eat their meals on time. So in fact, like I had a friend who had type 1 diabetes and she took up anesthesia because they told her that definitely as an anesthetist your meal timings will be perfect. So it's also very good for those people who have chronic conditions, those people who don't have that much capacity to work with starvation, with hunger for very long periods of time. Okay? So it's a very good way in that time that all your breaks are fixed. Now second thing is, once your routine OT for the day is done, the next thing we will be having is, after this, your emergency duties. Okay, Now emergency duties as a first year are quite hectic because they want you to get used to the day-to-day duties. So your always the first year ends up doing most of the menial work. Okay, so like preparing the OT, loading the drugs, making sure that the patient's PAC is done. The first year will be the first person to go and see the patient before the emergency surgery. He will see the patient, he will inform his senior, then the senior will come see, then both of them will induce the case together. So the first year is always the first one to come and the last one to leave whenever there is emergency duty. Okay, because he has to come, he has to see the patient, he has to inform his seniors. Seniors means his second year and third year resident, and he also has to prepare the operation theatre, make sure all the emergency equipment is ready. Once the case is done, at the end of it he has to put everything back, finish writing the notes, shift the patient, and then his work will be done. So most of the work is done by the first year resident, and this is so that you train them and sort of get them aligned to working as an anesthetist. But on the good side of it, the first year resident will also be getting all the cutting. So all your spinals, epidurals, blocks, intubations, everything, maximum amount of cutting goes to the first year so that he gets used to it. Alright. So emergency duties typically depends on the hospital. You may have any kind of emergency duty from once a week duty to twice a week duty. इससे ज़्यादा होता नहीं है if we are not counting the Sunday duties in this. So in most of the hospitals they have 1 to 2 times a week emergency duties. So this emergency duty either may be for 24 hours. So 24 hours means if I'm coming at 8 a.m. today morning, I will do my 8 to 5 p.m. routine OT. After that, I will start doing the emergency cases till next morning 8 a.m. And then next day I get an off. There are very few hospitals which give a post duty off to residents, but yes, there are hospitals like that. Then the second type is 36-hour on-call duty. So you may start from 8 a.m. in the morning, do your 8 to 5 routine OT, then 5 to next morning 8 a.m. you will do emergency duty, and next morning you will go for routine OT from 8 a.m. to 5 p.m. So that may almost go up to a 36 hours, 1.5 days of duty. Now many of you all must be thinking कि मैम क्या बोल रही है, 36 hours का duty कैसे कर सकते हैं? Okay. So don't worry, it's not like you don't get any sleep in these 36 hours. Again, there are many people who join anesthesia. Anesthesia is one of those branches where you will have big groups of people. Okay, it's not like it's just you and your co-junior resident and both of you all are struggling to cover up each other's duties. Okay, so it's more like there will be about if you talk about a good big government medical college, they almost have 40 students per batch, which will be divided as 15 students per call duty, per emergency duty. So out of those 15 people who are on call, about 6 of them will go and do some duty, then come back and rest. Then the next 6 will go and do the duty, then come back and rest. So that depends on the understanding that you guys have amongst yourselves. But yes, everyone will get at least some hours of sleep in the night so that you can work the next day also. Okay, so this is typically in anesthesia. If you ask me, the most understanding clinical branch is anesthesia. Your co-JR, your senior, your juniors, everyone will understand that you should eat on time. Everyone will understand that you need at least some hours of sleep in the night. No one will say कि नहीं बिल्कुल नहीं सोना है. Despite even if you have not slept, even if you have not bathed, you have to work. No, everyone understands each other. Everyone has a good rapport with each other. Friendships made are good. So it's a very understanding branch. So for those of you who are very sensitive, who don't want to like go crazy during your residency, anesthesia is a great option. Okay. So Anushka is asking, emergency duties are only for OT or EMD. Also we can be posted. So Anushka, emergency duties are basically of two types. It's mostly OT. 90% of the times it's operation theatre. But the second part about anesthesia is also critical care. So there are intensivists who come from an anesthesia background also. So just to give you an idea about how intensive care is, how ICU is, you may be posted in ICU duties also during your emergency days. So you may have to do 12 hours of ICU. So that is another kind of duty that you have, but 90% of the times it's emergency cases that come. So it may range anywhere from trauma to appendectomies to perforations to orthopedics to obstetric emergencies, emergency LSCS, pediatric emergencies, foreign bodies and everything, ENT, ophthal, so many emergencies come. So all those cases you get to do during emergency duties. Okay, KGM 350 marks, get anesthesia and private college merit seat. Okay, so as I told you before, this depends totally on the ranking more than your marks. It will depend on the comparative ranking that you have. Okay, so if you have a rank of between 1 to 15,000, you can expect a good seat in a government medical college, and if you have a rank between 15 to 30,000, you can expect a seat in a good private medical college. Alright, okay, so that is how your year 1 of residency will go. It will typically fly, but at the end of it, another thing I wanted to tell you guys is, if you see in other branches like in surgery or in orthopedics, if you think about the cutting, okay, cutting means developing your skills. So first year gets the least amount of cutting, because they will be like, let them learn more, and then we will finally, when you start coming towards third year, fourth year, you will start getting cutting. But in anesthesia, it's not like that. From day one, they will start teaching you the skills that are required to be a good anesthetist. From first month itself, they will start training you and giving you opportunities for intubation, for putting spinals, for putting epidurals, and in fact, you guys can ask your seniors also. It's not like you have to wait for 3 years to actually do what you're going to be doing for the rest of your life. So it's a very satisfying feeling that from the first year itself you are learning things that you would be doing for the rest of your life, and that's how you develop a skill in anesthesia. That's very, very important. Okay. No, Anushka, anesthesias don't get posted in emergency medical department all the time. That's not at all true. You all have proper duties once or twice a week in the emergency medical department. Alright? So that was about residency year 1. Now residency year 2, the main thing that happens over here is that you have little bit of an idea about what is general anesthesia, what is regional anesthesia, what is monitored anesthesia care, all that. Thoda idea aa jata hai. So then they will start putting you in all the super specialties. So in year 2, they will start sending you for postings in the specific OTs. Now this totally depends on which hospital you are in. So if your hospital has all these specialties or no, so they'll post you in neurosurgery OT, they will post you in obstetric OT, they will post you in pediatric OT. Then there will be ortho, which will give you an idea about regional anesthesia. Then cardiac, which will give you an idea about cardiac anesthesia. Then besides this, you also have interventional radiology. So we also give anesthesia for interventional radiology and critical care. Then we have the smaller branches like ENT, ophthal, ECT. ECT is electroconvulsive therapy. So can you imagine, did you guys actually know that you also give anesthesia in ENT, ophthal, psychiatry? So basically anesthesia is required everywhere. GI scopy, for gastrointestinal also you require anesthesia. So if you see, the whole spectrum of anesthesia is so wide. Itni sari jagah pe anesthesia is required. So you will never be short of work. ऐसा there will be no anesthetist who is ready to work, who will say मेरे पास cases ही नहीं है. Okay, in life you will not find a single anesthetist, especially in India, because the number of anesthetists is not enough for the number of cases, surgical cases that happen. Okay, so you will never be short of work. You will in fact, if you consider COVID was a time when many doctors also were out of work because they were doing only elective surgeries. But at that time, the whole anesthesia branch took up suddenly people started noticing us, people started paying us so much money to do COVID duties, because anesthesia has one of the most important things, and that is critical care. Okay, so if you guys plan to do any of this as your super specialty after anesthesia, these are all your options. You can specialize in any of them. Okay, so these are all your super specialty options. So when you guys plan to join a college for anesthesia, when you're going to fill your forms, preference forms, make sure that the hospital that you're filling in for your preference has most of these super specialties. So only if you have these super specialties will you train in them, and will you know whether you are interested in them for doing super specialization, DM, fellowship, etc. If you don't have these specialties in your hospital, then first you will have to go after your residency into a hospital which has this specialty, and maybe do a short-term fellowship or some senior residency over there to see exactly how it is like, and if you want to pursue it or no. So best would be join a hospital which has most of these super specialties and good work in them, so that you can try your hands at everything. Alright. Yes, Somnath, don't worry, I am coming to DM options after MD anesthesiology. We are going to discuss all of that. Okay, now residency year 3, as a third year resident, most of you are having increase in your responsibility. Okay, so what do you mean by increase in your responsibility? So mentally you will be left in charge of OTs. Even during calls you will be left in charge of the emergency OT. So you will be inducing cases with your juniors, you will be extubating cases with your juniors. For difficult cases you will be consulting your seniors, that is the post MD or post DNB consultants. But other than that, as a third year resident, you are supposed to be someone who will be able to manage a case on your own. Okay, so in many places they call a third year resident as the designated anesthetist for the case. Okay, so in fact this is almost like doing your own private work. So you will be doing cases all on your own, managing complications, managing situations that arise out of anesthesia, out of surgery, all on your own, and just taking little bit of help from your seniors if you don't know what to do in that case. So it's a very, very good and important time, third year of residency. At the same time, it's not like you get too much of work. Okay, so it's not like you are working too much if you are talking about time management. So third year is the best. Q, because they all want third year exam going students to study. So you get ample amount of time to study. In fact, many a times they make the first year and the second year resident sit in the OT, and they tell the third year resident कि once the patient has been induced for anesthesia, let the third year resident go outside and study. Let the first year and the second year resident manage the case so that they learn anesthesia, and the third year resident can go outside and study. So residency year 3 may you get very good, and that is not the case when you're seeing surgery and orthopedics and medicine and pediatrics. As a third year resident also, you will be working, you will be washing up for cases, you will not really get the time to study. The only time you will have to study is maybe 1.5 months before your exam. So anesthetists are the one who actually study throughout the year, as compared to any other branch in which they will be doing all last minute study before the exam. Okay, so you will get good amount time to study. You will also get good amount time to leave and go out if you want to go home, if you want to meet your special someone. वो सब के लिए in third year of residency you will get decent amount of time. Okay, so your work life balance is the best. As I told you before, in first year you will be the first one to come and the last one to go. In third year it's ulta, you will be the last one to come to the operation theatre. Once your juniors have prepared the OT, they have seen the patient, they have informed you everything, you will come, you will see the patient, you will inform it to the post MD, post DNB consultant, and then you will take the case. Okay, and you will be the first one to leave, because like your first year resident has to stay back and he has to put all the monitors back, he has to shift the patient, but third year anesthetists means if you're a very good senior, you will offer, you will volunteer your first year कि मैं कर देता हूँ थोड़ा तुम्हारा काम, but most of the times all this work is done by the first year anesthetist, so that the third year anesthetist, as soon as the case is over, once the patient is stable and shifted, they can leave and they can go and utilize that time to study. Okay, so this is typically how your residency year 1, residency year 2 and residency year 3 of anesthesia are like. Some things are constant throughout 3 years of residency. One is, you will definitely get time to eat every single day. Your breakfast, lunch and dinner will never get skipped unless something complicated is going on in the OT and there is no one to relieve you. So खाने का बिल्कुल टेंशन मत लेना. Anesthetists are well known for relieving each other to eat at proper timings. And second thing is, even sleep is not that difficult, because only on your on-call days you will be tired and sleep deprived. But other than that, on normal days when you have 8 to 5 p.m. OT, at that time you will leave by 5-6 o'clock. You will have enough time and no one will call you. If you are not on emergency duty, no one will call you because elective cases are over. Okay? So you can leave, you can after 5 o'clock, the whole time is yours. You can do whatever you want. Okay, even as a resident. Alright. Then next is senior residency. Anushka, don't worry, I will be coming to all those, how to settle abroad, how to give exams for abroad after anesthesia, everything will be discussed in this session. Okay, so next thing that we need to discuss is senior residency in anesthesia. So senior residency in anesthesia may, basically this is after 3 years of your MD or DNB. Now many people do senior residency for 1 year, many people do senior residency for 3 years. So it depends on what you want to do exactly, what all you want to learn, how good was the place where you did your residency. So if you have not practiced enough during your residency days, the senior residency will help save you. Okay, this is like the savior period. So for example, I trained in a hospital which mostly had oncology cases. So I was not very good at regional anesthesia. So then I decided that let me go and do fellowship for 6 months, 1 year at a place which specializes in regional anesthesia. So the senior residency time is used for filling up the gaps that you had during your initial residency days. So as I told you, all these are the super specialties that you should be training in during your residency. But suppose your hospital does not have neuro, or it does not have pediatric, or it does not have cardiac. So what you can do is, during your senior residency, go to a hospital which has these super specialties, so that you also train in them and you can manage cases in these super specialties. Alright, so that is about your senior residency year. Now in senior residency, you already have a degree. Okay, so you will be responsible for the cases that you do. You will be doing cases individually. If you are joining a medical college, you will get juniors under you, but they will be unqualified. So that means they won't have a degree. So the entire responsibility of the case will be on you when you are doing senior residency. But you also get paid well. So again, I will give you approximate figures of salary as a senior resident, because by this age of a senior resident, most of the people get married. So they definitely want to know how much is the salary as a senior resident. Okay, so if we are talking about a place like Mumbai, you can earn anywhere between 80,000 to 1 lakh rupees as a senior resident. And if we are talking about a place like Delhi, you can again, North Indian states pay a little more, so you can expect a salary anywhere between 1 lakh to 1.5 lakh, depending on whether you're joining a government institute, private institute, what kind of institute, what kind of package are they giving you. Okay, so the senior residency salary is quite enough to manage a family of even 3 people. If you have, or 5 people, if you have parents, you have a wife, you have child, you can manage well on a senior residency anesthesia salary. Okay, of course I'm giving you approximate salaries, but usually this is the range. Then after senior residency, what are your options. So after MD or DNB, some people also want to study more. They want to do super specialty training. So in super specialty training, you have two types of specialty training. One is fellowship. So fellowships are all short-term training. So you can have fellowships ranging anywhere from 3 months to 6 months to 1 year to 2 years. Okay, I can give you examples of all of these fellowships. It depends what branch you are interested in, what thing you want to specialize in. Okay, so there are 3-month obstetric anesthesia fellowships. So here you will learn how to put labor epidurals in obstetric patients. You will also learn how to manage emergency LSCS in difficult patients like PIH, in eclampsia, all those. Okay, you have 6 months training in regional anesthesia. In fact, this is one of the fellowships that I'm doing currently. So all your different types of ultrasound guided blocks, spinal, epidural, all of this you can train in. It's one of the many very upcoming and liked branches. So 6 months ka fellowship is available in regional anesthesia. Then you also have a 6 months fellowship in difficult airway. So difficult airway, how to manage it, how to do fiber optic, how to do awake intubations, video laryngoscopies, all of those things you will train in the difficult airway fellowship. Now, most of the fellowships are 1-year fellowships. Okay, so there are many people who just want to learn and they don't want to do a DM in that subject. They are like कि नहीं, हम 1 साल के लिए सीख लेंगे and then we'll join a hospital or we will start freelancing and be able to work. So 1 year is a good enough time period to do a fellowship. So if you want to work, because even residency is quite hectic. 3 साल का residency में you get very tired. So after that, not many people have the energy to continue for 3 more years of DM. So for those who have only less stamina or those who want to go out into the market early, you can do a 1-year fellowship. Okay, so 1-year fellowship you have in neuro anesthesia, pediatric anesthesia. Then regional anesthesia may also you can get 1-year fellowship, cardiac anesthesia. Okay, and then in some of the apex institutes of the country, you will have onco anesthesia and pain fellowships for 2 years. Okay, so this is a joint fellowship, onco anesthesia and pain, but you can also have pain fellowship over here. Then you also have one more thing in 1-year fellowship, and that is your IDCCM. IDCCM is nothing but the Indian Diploma in Critical Care Medicine. For those who want to do intensive care, those who want to become intensivists, if you don't want to do DM critical care, you can do this IDCCM, Indian Diploma in Critical Care Medicine, for 1 year and start practicing in the ICU. Okay, so this is also one of the good options. Alright, so this was about fellowships. Fellowships advantage, short term, you actually in 1 year you end up learning what you're supposed to learn, and immediately you can join a job after, and definitely they will consider you more as compared to someone who has just done plain senior residency, not specifically in any subject, or someone who has not done anything after MD. Okay, next option is DM. DM anesthesia mein what are your major options? So DM may first option you have is neuro anesthesia. This is there at PGI Chandigarh. This is there at NIMHANS, which is the apex neuro institute in our country. Second is pediatric anesthesia. You have DM courses in pediatric anesthesia in many parts of the country. Then next DM is in cardiac anesthesia. And next DM is in onco anesthesia. This is specifically at AIMS in Delhi, and next DM is in critical care. Okay, so these are all the DM options that are available after anesthesia. Now DM is 3 years plus you will be having a bond at many places. So in PGI, AIMS, all the central institutes, they don't have bond, but if you are doing it in a state institute, they will have another bond after this. So remember, you will be having your MD ka bond Plus you will be having your UG ka bond, undergraduate ka bond, postgraduate ka bond, and then your super specialty ka bond will also get added. So if you don't want to keep studying for such a long period of time, then consider doing a fellowship. Fellowship में bond नहीं होता है, ठीक है? Okay, one more fellowship I forgot to add over here is transplant anesthesia. So very upcoming and very cool branch now, liver transplant anesthesia, kidney transplant anesthesia. For all of this, you have centers which are coming now, and they want like dedicated anesthetists, because transplant surgeries go on for anywhere between 12 to 24 hours. So they want specialists to be there for those kind of surgeries. So transplant anesthesia is also another fellowship that is available in many places in India. Okay, then after that, the next thing that most of you guys want me to answer is, what are your options abroad? Okay, so many people after undergrad, they are not very sure whether after MBBS they want to go abroad or no. So they are always confused कि MBBS के बाद should we go do USMLE or should we try for UK PLAB? So let me tell you, if you go after MBBS, yes, it's possible to do it, but again the process is a little lengthy as compared to after your MD. ठीक है? First of all, there are fixed residencies that you will get abroad. UK PLAB becomes a little difficult to get into, and if we are talking about US and USMLE after undergrad, okay, I'm talking after MBBS, then in that case your options are very limited. For foreign medical graduates, they mostly give you medicine, pediatrics, and psychiatry. These are the three main, and family medicine, that is like these are the four main branches that you get in the US. So if you want to do surgery, if you want to do anesthesia, if you want to do derma, then it's very difficult to get post MBBS into those residencies in the US. On the other hand, if you do your residency in India and you apply to the US after your residency, so suppose you do MD anesthesia in India for 3 years, and after that you apply for USMLE exams and you apply for USMLE residency in anesthesia, which is considered as one of the topmost residencies in anesthesia. Anesthesia is considered as the topmost branch in the US currently. So your chances of getting into anesthesia residency and being an anesthesiologist in the US increase almost tenfold if you have already done your MD here. I know it is a longer procedure, doing 3 years of residency and maybe 1 year of bond and then going to the US and then repeating your residency over there all over again. But think of it in the scheme of things to come. If you look 10 years down the line, all that will not make any much of a difference. Those 3 years of residency that you did will just ensure that you get the branch of your choice, one of the topmost branches in the US, which otherwise would have been impossible to get. On the other hand, if we are talking about UK, okay, so let's talk in the options abroad in the main countries. So if we talk about first country, UK. So this I am telling you after your MD or DNB anesthesia. Basically after your residency is done. So UK has something called as FRCA, Fellow of the Royal College of Anesthesiologists. So here what you can do is basically after your residency there are two options. The first option is directly you can apply for a MTI. MTI is nothing but a medical training initiative post. Okay, so you can apply for a MTI post in anesthesia. If you go on to the MTI site, you will be able to see it on Google only today. So there are many of these hospitals that are there in the UK which will employ anesthetists from India. What is the exam that you have to pass post your residency? Nothing, only your IELTS exam, IELTS, that is a English language exam. So once someone sponsors your visa in from these MTI hospital and you have passed the English test, then in that case they will take your interview, they will sponsor your visa, they'll give you a sponsor letter. You can train there or you can join in the UK for 2 years, and in those 2 years you can give your FRCA exams. So you have FRCA part 1 and you have FRCA part 2. You can give both the exams, plus you can work and earn money. You can get a good decent amount of money ranging anywhere between 40 to 60,000 pounds per year, and this is a good way to work, to earn money as well as to study. Okay, so that is what you can do after your MD anesthesia if you are planning to go to the UK. UK is one of the easiest countries to get into after anesthesia. Now the second way of going to the UK is you can give some exams and go. So you can either give FRCA part 1, then go and work for 1 year in the UK, and then give FRCA part 2. Okay, or you can also give an exam called as EDIAC. EDIAC is the European Diploma for Anesthesia and Intensive Care. So it is, the exam is almost equal to FRCA part 1, and if you pass EDIAC you can go work for 1 year in the UK and you will be eligible to give your FRCA part 2. So depending on how long you guys want to work in the UK, you can definitely use one of these options, but UK is one of the easiest places to get into for anesthesia. Now remember, it's not like once you go there you are into the system and you can become an anesthetist in the UK. No, even after you pass your FRCA, if you want to get based in the UK, if you want to permanently settle in the UK, then you need to enter into training. Okay, so to enter into training in the UK, again you need to give interviews and get selected, and then that is another 6 years of training, anywhere between 4 to 6 years of training to become a consultant. But at the end of the day, working hours are much lesser than in India. Work-life balance is much better in the UK, and also the amount of money paid is much better in the UK. Alright, so those are your advantages of going to UK. Next is if you want to go to the US. So if you want to go to the US after your MD or DNB anesthesia, then in that case what will you do? So US is a little different. They will not consider the degree of MD or DNB that you have got from India. You will again have to give all your USMLE steps. The first thing is give your USMLE steps. So if you are planning to go to the US, then I would really suggest give your USMLE step 1, 2 and 3 during your anesthesia residency only. Especially in your 3rd year, you will get good enough time to study for it. Okay, so you have to give your step 1, 2 and 3, and then you have to also have some clinical work experience in the US. Like you can apply to some universities and ask them for one month ka clinical work experience. So using the letters of recommendations from there and your USMLE score, you enter into the match, the USMLE match. So you can, if you get selected, you can match into an anesthesia residency, and once you match into an anesthesia residency, then you start your training, and the training is for 4 years. Okay, so after doing your MD DNB anesthesia, then you need to give your USMLE exams and match, and once you match, then it's 4 years of anesthesia, and permanently you will become an anesthetist in the US once you finish your 4 years of anesthesia residency. Alright, so that is one of the other options. Next is UAE. Many of you consider this. UAE is a very good option if you don't want to stay in India, if you want to work abroad, but you want to be close to your house, you want to be close to your parents. If there is some emergency, you can immediately come back within 1 to 2 hours. Okay, so that is for UAE. UAE mein jaake what can you do basically? So UAE ke liye there are these separate exams. So for example, if you want to get into Dubai, so the Dubai has its DHS, Dubai Health System exams. You just need to give those exams, you need to qualify, and once you qualify, they will consider your MD DNB degree and your qualification in the DHS exam. And there are many hospitals that are there, so you can apply from here only. So if you get selected, you can start working in the hospital as an anesthetist. Again, Dubai pays you quite well, quality of life is good, and the good thing about UAE, I'm not talking just about Dubai, but also Abu Dhabi and other countries that are there in that United Arab Emirates. So all of them are very, very close to home. They speak our language, and you get Indian food easily. So life over there is much similar as compared to the UK and the US, and the weather is also pretty nice. It's not, the winters are not as harsh as in the European countries or American countries. Okay, and the fourth option that we have is Australia. Now this is one of the most difficult options to get into. So if you want to get into Australia, again there are a bunch of exams to be given. I don't know much about Australia, but the thing that I know here is, suppose you do critical care. Okay, after anesthesia, if you do critical care, maybe if you do a fellowship or a diploma in critical care, then it becomes easy to get into a hospital in Australia on intensive care positions. Anesthesia is not that easy to get in Australia, because they, everywhere I'm telling you except India, all other countries mein anesthesia is one of the topmost branches. So they are very reluctant to give foreign medical graduates their anesthesia seats. But critical care, definitely you can get it in Australia. So these are your major options. If you ask me, easiest to get into is the UK and most difficult to get into is Australia. Alright? Okay. So let's take one question. RR is saying, ma'am, DM restricts the options in anesthesia or gives added advantage. So it's actually two sides of both the coins. Of course it restricts your options, because if you do a DM in say pediatric anesthesia, then and you join a hospital, I will give you only pediatric patients. I will not give you any of the adult patients. So it does restrict your work. But on the other hand, if you are joining a corporate hospital or a government hospital, then someone who has a DM versus someone who does not have any super specialization or has a fellowship or has a diploma, you will be considered first for the job because you have a super specialty degree. Okay. Alright. So Bhavna is saying, ma'am, I have benign essential tremors. Can I take up anesthesia? Yes, absolutely. Don't worry about it. There is nothing in anesthesia other than, I guess, blocks, regional blocks that will be affected by tremors. But that also, as you train to control your tremors, you take medications, and as you train to give blocks, things can be aram se managed. So don't worry, you can take anesthesia. Sudeep is saying, I got a seat in AIIMS Raipur. I have been inclined towards medicine. What do I do? Okay, so it depends on what rank you have got in your NEET PG exam, and if you're getting medicine in it, then go for medicine. If you are not getting medicine, then you can go for anesthesia. Alright? Okay. Because anesthesia is very, very close to medicine. We basically study all kind of physiology, pathology of all medical disorders, and we treat patients accordingly, but in the OT instead of the wards. Okay. Now, next thing is, suppose we are talking about Indian jobs. So what would be your expected job timings? So first is freelancing. If you are going to go work with many different surgeons, then you are your own boss in freelancing. So you decide your timings. You can work anywhere from 3 hours in a day. So in that case, suppose you know one surgeon. So that you must have seen many people who are surgeon husband and anesthetist wife. So anesthetist wife will say, I will do only my husband's cases. So on that day, if the husband has 1 or 2 cases, she will come do those cases and go. So typically your work life can be anywhere between 3 hours to 12 hours. Okay. So if there's someone who's super ambitious, wants to earn a lot of money, wants to do a lot of cases in anesthesia, then you can even go to different surgeons and you can do all their cases in a day. So you can start your day at 6 a.m., 7 a.m. in the morning and end it by 6, 7 p.m. Then sometimes you'll get called for emergency calls also. But in freelancing, you are the boss. Suppose you are on leave, you can tell the surgeon, I am on leave, I won't be coming for the next 3 days. Please find a replacement, or you can give a replacement and go. If you have, especially for girls, if you have a family, then you can tell them, I won't be taking any calls after 6 p.m. But anything before 6 p.m. I would be happy to oblige and do the calls. Okay. So in freelancing, you're the boss. You can do your own bidding. Next is if you are doing a corporate job. Okay. So if you are doing a corporate job, now here typically you get paid a salary. Okay, yes, let's talk about the money also here only. So in freelancing you can actually earn a lot of money. So you can earn anywhere between 1.5 lakh to, now there is no upper limit, but if you work 12-13 hours a day, you can also earn 4 to 5 lakh rupees per month. Okay. So also depends on what kind of city or what kind of place you are in. The place where there are lesser number of anesthetists, you will get paid more because you will be considered as one of the rare commodities in that area. So smaller towns, they give very good money to anesthetists because the number of anesthetists over there available are very less. Okay. If you go to a place like Mumbai or Delhi, you already have so many anesthetists, so there's a lot of competition, so there you get paid less per case. Alright. Next is corporate job. So corporate job is again a salary job. You can get a salary anywhere depending 1.5 to 2.5 lakh rupees depending on your experience. So someone who is just freshly passed out MD can get around 1 lakh rupees. Anyone who's 3 years post MD DNB can get 1.5 lakh rupees. Anyone who's say 5 to 6 years post MD DNB can get around 2.5 lakh rupees. And if you're 15 to 20 years, then in now abhi ka timing ka you can get 4 to 5 lakh rupees. Okay, so this is your approximate salary in a corporate job. But corporate job timings are good enough. Okay, so like you start at 7 to 8 a.m. in the morning and you will finish only by 6 to 7 p.m. So typically you will be having 12 hours. They have a routine list. You have to finish the list and then only you can go home. You cannot say no to the surgeons because the private patients who are coming in all these corporate hospitals, they are paying for the surgery, correct? So you can't say no, today the OT timing is over and now we won't give you the case. The patient is fasting since morning, you have to take him up. Alright? So that is about corporate jobs. And the next option that we have other than corporate jobs is your government medical colleges jobs. So if you are in a government medical college, then yes, the salary will be a little less. If you are talking about the salary in that case, again it's a salary job. So here you will be getting a starting salary of say around 80,000 and it can go anywhere up to a maximum of 2.5 lakh rupees depending on what kind, and but this will be almost like 15-20 years post your MD. Okay, so 15-20 years experience post your MD, you guys will earn so much. And of course with years with experience with publications, your salary will increase, but it's a slow rise. But the advantage of government medical colleges is the timings, first of all. So timings are typically anywhere starting at 8 a.m. and finishing at 4 p.m. So lesser timings, very good for those who want a family life. Okay, so we are streaming again now. I'm really sorry. The laptop charging went off, and that's why I could not. Suddenly the whole thing went away. Alright, so this is about your salary and work timings. Yeah, so now something about leaves, because leaves are also important in life. It's not that you will just be working. So in freelancing you decide your leaves, but remember you can't take too many leaves because you will have to keep providing replacement. Corporate jobs, they have fixed number of leaves and usually these leaves are quite less. So they'll give you anywhere between on an average 20 leaves per year, okay, which will also include your sick leaves and vacations and everything. Government medical college, number of leaves over here are good enough. You can get anywhere between on an average 40 leaves. So there are also some nice colleges which give like summer vacation, winter vacation, Diwali vacation, and like maybe 10 days, but still it adds up. Okay, and then you have sick leaves, you have maternity benefits, paternity benefits, all of those things, okay, which are not there in freelancing and in corporate jobs. So government medical college will provide you with all that along with insurance for your family and for yourself. Okay, so that is the expected job timings, expected salary, as we have already discussed. Now what are your advantages and disadvantages of the branch of anesthesia? So Sameer wants me to tell about thesis. Thesis to residency में सबको करना ही पड़ता है. If you have a 3-year residency course, either MD or DNB, you have to do a study. It can be a simple audit related study or a survey related study, or it can be a complicated randomized control trial totally depends on what you are comfortable doing, what is your capacity, what are the kind of cases that are there in your hospital, and who is your guide and what do they want to do. Okay, so thesis manage ho jata hai, it's not such a big deal, everyone manages a thesis. Okay, now advantages of anesthesia branch. So first thing is मेरे लिए सबसे important meal timings. More or less I'm going to have all my meals at a good amount of time every day. Okay, now there's some problem with the streaming, suddenly it's become very slow. Because it's become slow. Okay, yes, we are back with the internet now. Okay. Alright, so I guess the internet is back now. Yes, so we can continue with this.